So now we begins with the RH incompatibility. It has been said that RH positive blood cannot be transfused to the RH negative person. If the RH positive blood is transfused to the RH negative person, then there will be the sensitization of RH negative person to the RH positive RBC which having the RH antigen. And in RH negative person, the antibodies against that RH antigen will develop. This will causes serious complications whenever the second time RH positive blood enters into the circulation or in the maternal life. So that is the RH positive blood. Whenever we are going to infuse to the RH negative person, first of all remember that both the RH positive as well as RH negative neither having the antibodies against these RH antigens. But whenever this RH positive blood enters into the RH negative person, this RH positive antigens going to stimulate the immune system against that specific antigen of this RH system. And in these cases, anti-RH antibodies are generated inside this RH negative person. This is for the first mismatch RH positive transfusion. Now whenever the second time this RH positive blood comes in contact with against the RH negative person, whatever the antibodies were generated during the previous transfusion going to attack and kill the cells of the RH positive antigen or RBC. So in that conditions there will be the transfusion reaction occurs. Now these are the table which represents the characteristic features of different types of immunoglobulins. But most important thing we have to remember that IgG can cross the placenta and IgM cannot cross the placenta. RH antibodies are IgG type and ABO antibodies are IgM type. So in this condition, these RH antibodies which are IgG type can cross the placenta and produce the RH incompatibility reactions. So that is the RH incompatibility. Whenever the RH negative female marries RH positive male, after the marriage, whenever this RH negative female conceives for the first time, and if she having the RH positive fetus, and if the RH negative female is not sensitized previously by RH positive blood, then this type of RH incompatibility reaction occurs. During the first pregnancy, the pregnancy period of 9th month is almost without any type of complications. But during the time of delivery of the first baby, some amount of fetal blood which is RH positive fetal blood enter into the RH negative circulation. And in these cases, this woman who is RH negative or the mother who is RH negative sensitized by these RH positive antigens of this RH positive fetus. Now what happened inside the RH negative mother due to the sensitization by RH positive antigens, then in these cases inside this female there is a generation or development of RH antibodies against that RH antigens. Everything went normal during the first pregnancy. Now these RH antibodies remains in the mother's bloodstream forever or for the rest of life. In the later pregnancies, if again the fetus is RH positive, whatever the RH antibodies are present inside the mother due to the sensitization via the first pregnancy, these antibodies cross the placenta and enter the fetal circulation and going to destroy RBCs of fetus. Now this type of reaction are known as RH incompatibility. That is the most serious type of reaction and one must need to note about this reaction during the time of pregnancy. Manifestations. Erythroblastosis fetalis. Now as I told you previously that mother's Rh antibodies going to attack the Rh antigens which are present on the surface of RBC, and in this condition these antibodies also going to kill or damage the RBCs of the fetus. So this condition is known as erythroblastosis fetalis. Hemolytic anemia in the fetus or neonate as erythroblastosis neonatum, which is caused by transplacental transmission of maternal antibodies to the fetal RBC. Yes, this is the only RH incompatibility because RH antibodies are IgG type and can cross the placenta, whereas ABO antibodies are IgM type and cannot cross the placenta. The disorder usually results from incompatibility between maternal and fetal blood groups. That's why maternal having a negative blood group and fetal having the positive blood group. Erythroblastosis means appearance of large number of erythroblasts in peripheral blood as hemopoietic tissue of the baby attempts to rapidly replace the hemolyzed RBC. So in this condition, the larger amount of RBC released into the fetal circulation, and these RBCs are immature and that's why they are known as erythroblast. And due to the high number of erythroblasts which are present in the fetal circulation, this condition is known as erythroblastosis. Alright. Now anemia is an obvious condition due to excessive hemolysis of RBCs by Rh antibodies. So this condition is known as erythroblastosis fetalis. Now the second one is the icterus gravis neonatum. Jaundice may occur within 24 hours of birth due to excessive formation of bilirubin as a result of excessive hemolysis of RBC. In this condition, liver and spleen are enlarged. So whenever there is an excessive amount of bilirubin formation occurs inside the fetal circulation, this condition is known as icterus gravis neonatum. And in this condition, liver and spleen are enlarged. Kernicterus. Excessive bilirubin formed may enter the brain tissue as the blood-brain barrier is not well developed in the fetal circulation, and it going to affects the basal ganglia, and due to this there is a disturbance of motor activity. In this condition, the serum bilirubin level is more than 18 milligram percentage. Please note that. So kernicterus, which is due to excessive bilirubin formed, which may enter the brain tissue as the blood-brain barrier is not well developed. Now this blood-brain barrier separates the brain from the other side of the blood circulation of the body. So due to the presence of this blood-brain barrier, the toxic substances cannot enter into the brain and produce the toxicity. But in the conditions of fetus where the blood-brain barrier is not well developed, in these conditions the excessive bilirubin which is present in the blood circulation enter into the brain and produce different type of abnormalities, and it going to affect the basal ganglia, and due to this there is a disturbance of motor activity, and this type of complication occurs whenever the serum bilirubin level is more than 18 milligram percentage, and this condition is known as kernicterus. So now the fourth condition is the hydrops fetalis. In this condition, fetus is grossly edematous, hemolysis is very severe, and intrauterine death of the fetus is the complications of this condition. So we had seen four type of Rh incompatibility consequences. First one, erythroblastosis fetalis. Second one, icterus gravis neonatum. Third one, kernicterus, and fourth one, hydrops fetalis. Now the prevention and treatment part, how we are going to prevent this type of complications. So in these conditions of Rh negative mother with the Rh positive fetus, just after the first delivery, we have to give Rh immunoglobulins or Rh antibodies in the form of Rh immunoglobulins to the Rh negative mother. So it's going to neutralize whatever the Rh antibodies which are generated inside the Rh negative mother, and we are not going to face any type of serious consequences of RH incompatibility in the later pregnancies. That is the first option. Now the second option, and if the baby is delivered, in this condition we have to do the exchange transfusion, where we have to replace the baby's whole blood with the fresh new blood.